Okay, thanks very much, Rich. Okay, thank you very much. Welcome everyone again to coming to one of our community champion meetings. Thank you very much for giving up the time and joining us this evening. I'm going to introduce Dr. Jonathan Lazell later on to talk about the COVID vaccination programme. That's the main topic of our conversation this evening. I just wanted to give an update on the neighbourhood testing centre, the community testing centre at the Friendship Cafe, which we talked about at our meeting a fortnight ago. Just to say that because we've got more capacity there in terms of who is eligible to go and have a lateral flow test, and we've extended the eligibility to anybody who's a Gloucester City resident who has to go out for work or caring responsibilities and isn't able to work from home. We've got quite a lot of capacity at the moment. We can take more people for testing, so I'm asking you would help us to get the messages out to people in Gloucester City that it applies to, that they can go along and get the lateral flow device testing. I know some of you have been there because I saw you particularly on the first day, but it would be really helpful because we, as I say, to use that capacity that is there and available to get people tested who can't go out and can't work from home. We are going to do some more other messaging with communities and get some posters out for particular communities within not just Barton and Treadworth now, beyond the city, but I'm just wanting to ask you if you can help us with that. Great. Okay, so if we move on to the main topic for conversation this evening, which is about the COVID vaccination programme rollout in Gloucester. We're fortunate that we've been joined this evening by Dr. Jonathan Lazell, who is Clinical Director from Rosebank Primary Care Network, and Dr. Chantenaire, who is a GP at Barton Gate Surgery, who I'm sure will be familiar to some of you. Right, so I'm going to stop there and introduce Jonathan, who will talk about the programme from Rosebank.
So yeah, hello to everybody, and it's great to have lots of people on the call. I mean, I hope I can answer some of the questions, but we have at Rosebank Network, we've been involved in the local vaccination centre based at Rosebank Surgery on the Stroud Road. So the vaccination centre there is for Rosebank and Barton Gate patients, part of our network, but also goes wider than that because it's also for Hadwin Surgery and for Quedgley Medical Centre, and also some of the inner city practices. So that's Kingsholm, the Ricknell Pavilion, and it covers quite a group there, including the GHAC team. So that's the Gloucester Health Access Centre. So that covers quite a big group, a big population. So it's probably about 90, just short of 90,000 people who we're looking to sort of cover that population. So we started mid-December with the Pfizer-BioNTech vaccine, and we have been trying to deliver vaccine each week, and we're working through the main priority groups that we've been asked to do, and we are really primarily dealing with first doses at the moment. So where we've got to with it, we've managed to vaccinate the vast majority of our over 80s, which were the first group, along with care home residents and care staff who within those care homes. So that's been quite a good achievement that we've been able to do as we've been working collaboratively with other networks. So those of you may have seen Rosebank as a vaccine hub. We've had volunteers, we've had admin teams. So it's been quite a big sort of team effort. So we're thankful for everybody involved. But we are really passionate about trying to get this vaccine out to everybody who needs it, and across the area that we cover. And I know traditionally some parts of our practice are harder to reach than others. We are planning to do our housebound patients, which is being sorted this week, and we're working through the various priority groups. So I think we're down to the over 70s that we're moving into now, and to those who are clinically extremely vulnerable. So we will be covering those first 4 priority groups very soon, and then moving through further cohorts. So beyond that, it'll be over the 65s, and then probably the under 65s who have other health conditions, and we'll work our way through the groups to over 60s, over 55s, and then eventually over 50s. So that's the plan. And at some point, we're going to have to sort out a second dose for everybody as well. So from our vaccine centre, we are also getting supplies of the AstraZeneca vaccine as well as the Pfizer-BioNTech vaccine. So depending on what clinic you're booked into, you may get either of those vaccines. So shall I pause there in case anybody has any questions, particularly as I've said those things? No questions that have come up yet. So, as I've said, we would really encourage, those who get an invite to attend. One of our challenges is trying to get the message out to individual patients. So we have used various sort of messaging platforms to send a text message to those people who do have a mobile phone, and a lot of our older folk, they still do communicate very well with mobile phone and modern technology, which is great to see. We've also been trying to ring them on their phones, sending out letters. So we've tried all ways of contacting them. So if you are, I suppose, the daughter or a son of an elderly person, it may be worthwhile just seeing if they have received a letter, and trying to encourage them to come down for their vaccine if they've been invited. So I don't know if, again, any questions have come to mind as I've been talking. How do these vaccines work? I can see a question that's come up. Well, the vaccines, they work in a similar way. The Pfizer-BioNTech vaccine is a novel vaccine that has it's a new type of vaccine which carries a bit of messenger RNA from the so it's inactivated bit of the COVID virus, which is then enveloped in a sort of fatty covering, which allows it to get into cells. So it doesn't cause the infection, but it does stimulate T cells and antibodies against the COVID virus, particularly to what's on the surface of the COVID virus, which are these spike proteins that you may hear people talk about. So that's the novel Pfizer-BioNTech vaccine. The other vaccine, AstraZeneca, it carries a bit of the spike protein element to it, which is carried in a inactivated chimpanzee virus, which is a different way of carrying it into cells, and again priming a response for the host body. So that's the person who's been vaccinated to develop T cells, which are part of our immune system, and other antibodies to fight the virus. So the idea is that once we've had that vaccine, if we were then subsequently exposed to the virus, our immune system would be ready for it and would effectively nip it in the bud and stop it becoming serious. Should I keep running through these questions, or how did you want me to answer more questions?
There are some more questions that came in via email. So can we run through those ones first, and then we'll go to the ones in the chat, if that's okay?
See if I printed those off. I'm not sure I've got them to hand in front of me.
No, okay. Shall I read? So one of the first questions was, I am 64 years old and also an unpaid carer to my mother who's 86-year-old. Roughly when it will be my turn for vaccination?
So I think it will be a bit further down the list as a 60-year-old. Obviously, as I was saying, probably going through the priority groups. I think that is priority group 7, which is the over 60s. So that's where we're at. Say we are trying to get through the main 4 cohorts by mid-February, and then providing we get supplies of vaccine and can keep going, then hopefully it'll be a matter of weeks before we do hit these other priority groups a little bit lower down.
Okay, thank you. Just to say, I'm going to go through the list of ones that we've had in the mailbox first, and those that you've raised your hand, I'll come to you next after we've gone through those, if that's okay. The next one was about, is there going to be an opportunity for local employers to have a vaccination rollout at their place of work?
Okay, so at the moment, I haven't heard anything of that happening. Everything has been tightly controlled from government through NHS England to the vaccine hubs, which has been quite a stringent way that these vaccine centres have been approved, and standard operating procedures for delivering the 2 vaccines on site. And there are standing operating procedures for taking it out to housebound and for care homes, but it's all quite involved. So far, there's been nothing I've seen about it going out to employers.
He's got mascara on.
Right, thank you, Jonathan. The next one is similar to the first question. How confident are we the COVID vaccines are effective, and does the vaccine need updating with the new variant?
Well, I think we are confident that they are effective. I think they've looked at the efficacy data, haven't they? And some of that suggests for the Pfizer-BioNTech, they're up there in the 70s, 80s, 90%. So it is certainly effective, probably more effective than the standard flu vaccine that we have each year. In terms of the new variant, I understand the science is saying they expect it to continue to be effective, but this is being monitored, continuously. So they are just trying to keep an eye on it. And I don't have any other insider information about these other variants, but to my mind, or from what I understand, this vaccine is still effective for these sort of minor changes, these minor variants.
Okay, thank you. The next question is, what are the ingredients in these vaccines?
The ingredients, so there's no animal products in either of the vaccines. I suppose the vaccine, as I said earlier, contains bits of DNA which they've extracted from various in different ways, in very clever ways. I think the other sort of the sort of liquid that the vaccine sits in is made up of water, saline, tiny bits of alcohol I think are in there, and then some other chemical ingredients that I'm not sure of all the names of them, L-histidine or something along these lines. I haven't got the list in front of me, but I don't think there's any animal products within them. That's all I would say.
That's the one, the monkey DNA.
But it's the virus, isn't it? So it hasn't actually got monkey DNA in it as such.
It's got a baby DNA. It's
Human.
Okay, we'll have to find out a little bit more about that if there's a specific concern about that.
And most importantly, that animals are not being killed to prepare these vaccines, that we need to take into account. And also, I would like to make a point that yes, there is extremely minute quantity of alcohol, but I request everyone not to get put off by that, because this is in the sort of medicinal effect. It is not a recreational effect. It is not going to produce any kind of recreational effect, which people are, which we say that is not good. So even if there is a very minute amount of alcohol, it is for medicine. There isn't any other option. And therefore, I sincerely hope that it should not be any community of it.
I thought monkey DNA is baby. Zooming in, Brown. Shanta.
Yeah, there may be chimpanzee DNAs that the part of the cell of those, but it had this vaccine production has gone through ethical committee, and they have looked at all these ethical issues, and only when the ethical issues were correct, this process of the procedure of preparing vaccine was given permission to. And that's all I can say at this stage. And there are many other vaccines which do use similar technology.
Excuse me, Dennis here. May I have say a word?
Yeah, Linda, did you want to come in on that one?
Yes. You mentioned ethical committee. Surely that ethical committee doesn't really relate sometimes to the actual people in the certain people in the community, does it? because we haven't got a say, to be honest with you. I mean, if an ethical committee, which comprises of whoever sits around, have certain data and said, okay, I think they should find this acceptable, you know, well, can't go too well on that. But there's another issue for me, and that is, you know, they quote the percentage effectivity of these vaccines. And I'm a bit skeptical of the fact that they, oh, well, it's not a fact really. I don't think anybody will come, that they have actually tried it out on enough people to confidently tell the population that it is 80, 90 or whatever % effective. I personally would rather them to say, right, it is effective up to such a thing, as far as we've tested out on, say, 3,000 people. And because of the situation that we're in, which is very, very dire, you know, I do appreciate that. It's a dangerous situation, is in that there is no better alternative at the moment, you know, and that they'll follow it up with a program, a research program, whereby after people have been vaccinated, periodically they would be screened to see what thing. I think that would be a much more fairer attitude to put towards the people, because yes, I've got a scientific background and an engineering background, and I don't really like, I like to be faced with the bare truth. You know, I think people often can accept that more than being guided, and then later on they find out that something went wrong. Because that's another point. Will people be screened, and what happens if something does go wrong after with certain members of the population? And what will I'm not talking about the NHS, will this drug company stand up and put funds in to ensure that this is rectified?
You want to answer, Jonathan?
Well, only that I would say it would be the same procedures. There's quite strict procedures for follow-up, and as you probably know, this is being continually monitored, you know, its effectiveness and how it's working in a real life situation. I suppose they have the research data or the trial data that they've used, but now it's going out into the real world, into thousands and thousands of people. Then more information will come through, and I believe that there's more information will probably be made public in a couple of weeks' time as to some of the effectiveness data, as we see, you know, hospital admissions and, you know, COVID pneumonia infections. All this is being analysed as we go through. In terms of, you know, whether a drug company, I guess it's gone through all the appropriate approvals. It has gone through all those through the medical licensing board, so it's the same as any other drug. And yeah, I can't remember what other specific questions you had, but I guess the drug company, if they've done something which they shouldn't have done, then they will have to account for that. But to my mind, they have done everything correctly, and it has been scrutinized and peer reviewed by, you know, lots of scientists, and that's where we've got to, you know, at this stage, to try and deliver this vaccine out to the population. And as you said, you know, it's the best thing we've got against this, you know, this wretched COVID virus.
And once we give vaccine, and if there is any unusual side effect, if we notice, then we have got a system called yellow card, which we fill, and we inform the medical, so the governing body, which looks after all the side effects and all, which I'm pretty sure does get conveyed to the manufacturers, and if needed, they will in future. But it is a bit early at the moment, but there is definitely a system to note down and to inform the correct organizations about unusual side effects or anything, not just the deaths, but even unusual side effects, we do inform the correct organizations.
Yeah, because I appreciate how difficult it is for everybody, both the doctors like yourselves and the NHS in general and the government particularly. But so we're living in very really crazy times. But as I said, I think there should be more upfront, honest, and because I think the people will take it because of the reason I said there's no, at the moment, no better alternative. So it's a case of instilling confidence and reassuring people.
Yeah,
Thanks,
no,
Lyndon.
I agree. Thank you.
Can I bring in Jennifer with her question, please?
Hi, just to say thank you to Dr. Lazar and the team at Rosebank. We as community champions, we're all very grateful for everything that is going on to get this vaccination or whichever variant we can get out to all our elderly vulnerable groups. On that note, you say you are trying to reach everybody. Would it help, say, through the community building collective with Richard, that some of us put it on our platforms to extend and ask that people connect with their elderly relatives if they're doing shopping, that they check with their elderly families and residents and neighbours that they have been in contact and took up the great opportunity of getting the vaccine? Would that help?
Certainly it would help, because I think we have now, particularly the over 80s, we have contacted everybody in various forms. We've tried very hard, as I say, phoning them up, writing to them. So if there are a few people who have been lost in the system, either because of wrong phone numbers or changed addresses or whatever, then yes, it would be helpful for that group. We are still,
I
probably
think
the
Richard Cook would be
is
able
probably
to.
true as well.
Richard Cook and Abby Griffith, they will be the great ones to actually give us some sort of idea of who to put this out to, and then we can all put it out onto our platforms, if that will help.
Jenny, I'm on the call, my lovely. I'm here.
Oh, hi, darling. Hi.
So for those of you that don't know me, I also work with Dr. Lazar and Dr. Nair. I'm the social prescriber at Rosebank and Barton Gate Surgeries, and I work very closely with the community teams in and around Barton Gate and, well, anywhere really that we cover. Jenny, yeah, 100%. Please, if you go and deliver food to anybody,
yeah,
just asking that question of, have you had your letter? Have you had your text? Have you followed it up? I've been a part of calling patients. I see one of the questions is how else can we get the word out there? We've got a social media platform from the surgery, but we've also got a social prescribing media platform too. So please share and share away.
I will, and I will put a note out so that others can share onto the platforms as well. And please get better, darling.
Yeah,
I will. Thank you.
If I may.
Thanks, Abby. Thanks, Jennifer. Can I also then bring in Omar next, please? Can you mute if you're not asking a question? Thank you. Omar had a question.
Yeah. Hi, Dr. Lazar, Dr. Nair, thank you. Just to introduce myself to anyone who doesn't know me, I'm Dr. Omar Javid, and I'm also chair of Young Thinkers Gloucester, which is a voluntary organisation in the Barton and Tredworth area. Just following on from what Jennifer has said, really, but also not just in terms of advertising and spreading the message on social media, but we have a group of volunteers from various backgrounds, and we'd be keen to help you with direct engagement and direct contact with those people who you haven't managed to contact, whether that's through telephone calls or other means. If you needed some support in directly getting a hold of those people, we'd be happy to provide our volunteers to try and help you with that, and in any other way that you think.
Omar, that's brilliant. I'm going to jump in ahead of Dr. Lazar and Dr. Nair. I think probably you and I should have a conversation as the social prescriber for the surgery. If you want to pop me a a message in the chat, give me your email address, and then yeah, you and I can have a chat, and then I can follow it up with the GPs on tomorrow or Wednesday.
Sure, great. I'll send you a message.
If you bring me in as well, Abby, I can make sure that all the food consortium groups get that message as well, if you like.
Yeah, that's brilliant. Thanks, Jenny.
All right, lovely.
Thank you. That's what we want, community action happening as we speak. Abbas, did you have a question that you wanted to ask?
Hi, Jai.
Hi.
I put my question on the chat board, and mine was any areas of gaps where priority groups are not responding, and how would you like community champions to help in that area? So any gaps in people taking vaccine from the BAME community, and same as the rest, areas that we can help support getting a message out or increasing take up in particular BAME groups that are not responding.
Again, I think it's all about the community. I don't know if Dr. Lazell or Dr. Nair
Really.
have got anything else to say. I think it's all to do with just, you know, getting the word out to the community, and, you know, and yeah, just reiterating the fact that they will get sent text messages, they will get sent letters, and please respond to it. The uptake, you know, as Dr. Lazell has said, we've vaccinated, or the team have vaccinated so many patients. The uptake has been remarkable. We've had people ringing us. I've seen all the lists of people saying, you know, I'm able to come at short notice. And, you know, if people are in those priority groups and they do get a phone call, it could be that they are given, you know, can you come in the next hour because we've got some vaccines left over, and it's just about, you know, just reminding people that they may get that short notice request, and if they can get to the surgery within sort of 10 minutes, half an hour, whatever, then that's great. It will just save us having to look elsewhere to give those vaccines.
Thank you, will do.
Thanks, Abby. Next was Haroon had a question about funding for BAME communities, which I think I can respond to, because that sort of funding that I've just came out today, Gloucestershire as a county aren't identified as one of the target localities, but we do in public health get funding that comes through the Outbreak Management Fund, and some of that we are hoping we're going to target towards voluntary organisations and groups that have been helping to disseminate messages and things out to people, and you know, as trusted individuals. So yes, there will be potential for funding to go for groups within Barton and Tredworth. We're just working through how that will work. There was a question from John Jones, but I think he's left the meeting. So I was then going to go on to Blanche, who had a question. It may have been answered already, Blanche, but was there something else you'd like to add or ask?
Yes, as you know, the BME community, especially the African Caribbean community, they are still quite scared about the whole thing. So I'm not sure what we're going to do to reassure people, because there's a lot of pictures and different things, not just from BME group, but from white groups that I know of, you know, who are showing some people very bad complications from the Marina vaccine. And so, you know, they're not reassured really. And what are we going to do to reassure them really about that vaccine? I mean, I saw a lady, someone sent one out today, and it was just awful. This lady was just having this shaking. It was more than Parkinson. It was just, she can hardly stand up, and people seeing all of these things, and they don't want to take it up front. So it's not that many are refusing to take it, but they don't want to really take it up front because they think that the testing wasn't done long enough. So that prejudice is still there.
I suppose it's always a struggle, isn't it, when somebody puts one bit of bad news out, everybody remembers that, but all the other positive data that goes out saying it is safe, it's effective, and the thousands and thousands of people who have had it tends to be forgotten, and so just an anecdotal message is can be quite damaging when we're trying to reach these populations. So as far as I'm aware, there haven't been any substantiated claims of these serious effects, but I haven't seen the sort of reports that you're talking about.
Well, it's not report, it's things just been sent around online.
Right, okay.
There's a lot of things being sent around. I was watching a doctor today. It's not here, it's in Africa, and he's warning his country, you know, not to give any of his people in that at this particular time of the vaccine. So there's a lot of mixed messages really going around.
Okay, so how do you think we could work to improve the communication that the vaccine is safe and effective? Because it seems that, yeah, people perhaps are swayed by other bits of information, aren't they? So
yes, they are swayed because family would be texting and sending by email or WhatsApp or whatever and showing pictures as well. I mean, today I had 2 from Canada sent to me from my family over there. I had another one sent from another part of America of a doctor in Zambia. Don't want none of his people have this, you know, and you don't this vaccine. And so it is very, very, you know, people are having a lot of mixed messages, really, a lot of mixed messages, and very, very scared because the pictures that they've seen, it's quite awful. And so, you know, there's a lot of things going around, a whole lot of things. And obviously you may not be the person who get all of these things. So I don't like to share a lot of these things but they are being sent out.
Could I invite Marla or Caroline to come in on this from the CTG, who are working on some of this, who are here this evening?
Hello, everybody. I'm Marla Uby. I'm a GP in Cheltenham. And thanks for having me here. It's been really interesting to listen to everybody's comments. I'm also on the clinical commissioning group for Gloucestershire, and my colleague Caroline is here as well. So I'm here as a GP listening to this, as well as somebody who's really interested in making sure the vaccination is fairly given to everybody. I'm a British Indian Brummie myself, so I have a personal interest in this sort of situation too. Blanche, it was very interesting to hear those concerns, and I think it's so important for the people who are going to be supporting the vaccination programme to be able to feel comfortable they can answer all the questions that you're asking today, because I think it's really hard to put forward clear communication if our community champions have questions to begin with, because that communication has got to be crystal, and it's got to be impactful, and it's got to be someone that you trust telling you that the vaccine is safe. Yeah. In terms of what we're doing as a whole system, we're meeting as a locality, trying to understand how we can make the engagement for different groups of people better. So I know that Abbas asked a question earlier about BAME groups specifically, and that's something that we're looking at. So at the moment, we're getting the data together about, of the patients we've vaccinated, are we able to work out how many are from Black and minority ethnic backgrounds, for example, bearing in mind that we know from the census in 2011 that most people from Black and minority ethnic backgrounds actually are under 65 years old. And the priorities by the government vaccination, as you know, have started at 80, over 75, over 70. So these issues are going to become more and more important as we work down the cohorts, because we're going to have bigger proportions of people from Black and minority ethnic backgrounds. As some colleagues have mentioned on this call as well, there's lots of other people who may not be getting the vaccine or getting the right messages about the vaccine, depending on their language. We know Polish, for example, is the second most common language across Gloucestershire. Are we doing enough to engage people with their community leaders to know that the vaccine is safe and they can have it? We also have other pockets of people who don't have fixed addresses. We have the travelling community. So we've launched this group trying to formalise a way of improving communications, hopefully we'll be engaging some of you and your colleagues as community leaders, because what we really want to do, hopefully, is to get clear communication about what is the vaccine, all the things we've been asking today. What is this vaccine? What are these side effects? What are these horrible things people are seeing? And is that going to be indicative of everybody, of what everybody's going to have? Hopefully we're going to be able to give people a message that it's incredibly safe, it is well tested. I've had it, for example, and hopefully we can have these powerful messages by people who the community respects, so that we can help these pockets of people across the county get the vaccine that they really need. So in answer to your question, that's a long answer, I'm really sorry.
Yeah,
but it's just to say that some of the issues that you've mentioned absolutely need to be thought about, and we're trying to work through those at the moment. So we're coming to have a listen to see how wonderfully you guys all work as a community, and hopefully we can translate that across the county. Thank you.
Dennis, sir, may I come in here a minute? Is that okay? Could Dennis have a word?
Yeah, go ahead. Go on, Dennis.
Yeah, I do agree with Blanche. There's this very, as mentioned before, deep concern. A lot of it is historic. A lot of it, because there's a group called WIMS at the moment, which we're working to facilitate sort of new or better understanding to of the NHS, to the BME community. And but as a lot of things have been historic, and a lot of things have gone wrong because well, it's not if we believe it, we know very well that a lot of mistakes have been made because of lack of understanding, ignorance. You know, when you're in this sort of business, whether you're an engineer, a doctor, a chemist, or whatever, you've got certain personal standards that you like. You like everything you do to be perfect. I appreciate that. Also, you've also got restricted by what the powers to be above you meets out, because they've got different criteria. And then they have got to listen to the government, who've got their own personal agenda, you know, wanting things to look good. So the pressure moves from up there downwards. And so things are missed. Some of the things, as far as my attitude to life is, just give me the bare facts as you've got it, the best you've got, give it to me, and let me see it in black and white, and let me choose. Because then that way it's more honest. Because we were having a seminar the other day on Zoom, and I happened to have the television on, although it was turned on, when the Prime Minister came on with, you know, talking about COVID, and the doctor there with him. And, you know, what we were talking about and what was coming across to me, that's when I made up my mind. And it was very simple. The final piece of the jigsaw came in. We haven't got a choice but to use this vaccine. And that was a personal thing. I know what I will be doing, because in general, we haven't got a choice. It's too big. It came on us, well, we reacted too slowly, and, you know, everything's backing up. It's not a matter of saving the NHS. It's a matter of helping the NHS to save lives, because that's what it is. They haven't got the capacity, and the vaccine is there to ease this pressure coming on. And it's reassuring. You get the vaccine. I guarantee if you gave a lot of people placebo, it would calm them down until you get a sure or better thing. It's a risk. It is a calculated risk, and nobody will convince me of anything else. But it's a calculated risk because I'm willing to take. I've had operations in the hospital. I knew what the odds were, and I put my hands myself in the hands of a professional, hope for the best, because I believe they will do their best. And I'm sure that is what you're, not patronizing you, I'm sure that is what all of you here as doctors, etc., will be trying to do. You see, but if you take the vaccine now, I'm sorry to be coming at you, Marla, but you take it today, you are not sure what effect it will, because there just isn't time. And I do appreciate that. So I'm not going against that. What I'm saying, we want to, if I was to go out there and speak to some other people, and well, I've already spoken to them quite candidly about how I feel about it. But if I'm to convince someone, I want to just be able to just, these are the facts that we have got at the moment. This is my personal view as to what I will do. Please look at the facts that the professionals have got so far and make up your mind. And I'll also let them realize just how dangerous this thing is. And one of the major problems, sorry I keep going on, well, one of the major drawbacks is it's not really just the virus, is it? It's the lockdowns that we're having. That's having a very devastating effect on the community. So that's another thing that if you find a way of tackling that, because yeah, the vaccine probably will alleviate this. So, you know, because there's a mental health and words of that people are going through. So, you know, it's not an easy task. It's complicated. But coming from the Caribbean community myself, you know, I'm willing to have a go, because there's a lot of elderly people out there which I've come to respect. And believe me, to me, life is absolutely sacred. Any way you can prolong it, you know, that's my attitude. I can't answer for everybody else, but that's my personal attitude.
Dennis, I fully understand, and actually you've articulated very clearly the complexity of it, the importance of building relationships and making sure we have clear communication, that weighing up of personal risk, informed consent, that we're providing patients and colleagues and communities with all the evidence we have right now at this moment, because you're right, we have to act in good faith on the evidence that we've got to do the best we can do. So I think you've articulated those complexities perfectly, really.
Caroline, did you want to come in here? Caroline,
yeah,
from the CCG.
Sorry. Yeah, thank you. So yes, I work with Mal at the CCG, and really just wanted to add to that. The points you've raised, Dennis, and others this evening have been really interesting, and I think helpful for us in trying to understand the kinds of information that you want to know. So we have developed some information already on our local NHS pages, and I've put the link to that in the chat, and I can see there's also a link that Tem has put there to some information that's targeted particularly at the BAME communities as well in Gloucestershire. So we are trying to build that information, but we appreciate not everybody's able to use the websites or happy to look at information there. And so I'd be interested to know if you've got any ideas about how we can make that perhaps more real for people, how we can provide you with those kind of key messages to help spread with our communities too. I know that Jonathan's made some films, for instance, about the vaccine centre at Rosebank, as of some of our other PCNs. So we have got some of those things that we're trying to put out on social media. But it is helpful, and I've been making a note of the questions that have been asked this evening, and we'll also incorporate those into the website information that we've got in an anonymous way, of course, but just so that helps with sort of, there's a frequently asked questions section there, and those are exactly the kind of things that we need to know that people in your communities are hearing, and how we can then sort of provide information that will perhaps provide some of that reassurance for them, because as you say, Dennis, it's about choices that we all have to make. But it's our duty to obviously provide you with the right level of information so you can make those informed choices for yourself.
Yes. I did put a note on there about, if you could produce some leaflets with such information that we can take around and issue to, because we issue what food stuff to various elderlies at the moment, every Thursday and Friday.
Okay.
So we could put it along in the parcel so
Yeah.
that we ensure that everybody gets that. So we're quite willing to do that.
Okay, that's really helpful. Thank you. And we're trying at the moment to just kind of pull together some sort of short information leaflet that gives you the key points, because there's lots and lots of information on those different web pages. So it's just about those headlines that are really crucial, and that they'll then be able to sort of direct people if they want more information, that they'll be able to look at in the right places for those too. Because we know that there's some misinformation out there as well, and it's just about how we can provide that reassurance for people. So that's really helpful. I am trying to pull together a shortened version of that information at the moment, and then we also want to get that translated into some alternative formats and languages for you as well, if that would be helpful.
That would be very helpful. Thank you. And one of the things we mustn't forget, people are genuinely scared. They really are.
Well, it's Blanche here from Howard Church on the weekend, Sunday. We have an international church service for the nation, obviously go abroad as well. And that will be the topic on Sunday, so as to reassure the people, the BME group, that to have the vaccine, because many have been asking the bishops about that. And so Sunday evening on our Zoom meeting, that will be the topic for the day, and we're having health professionals there so as to reassure our churches. So even local members from here are also on the program, so some of our members from the church will see the information, also encouraging them to, or give them the choice. They can have their informed choice.
Would you like to take our email addresses so that you could contact us in that way if you wish?
Yes.
If you give your permission, we can give those to Caroline and Marla.
Oh, yes.
And pass them on, if that's okay. Thank you.
Yeah, that's all right, for Dennis. You
Okay,
have got mine, haven't you? I think you have mine.
Yes, we've definitely got your contact details.
You can use it as.
Okay. We've also been joined by Hayley from the BBC. She's just put a note in the chat. I didn't know if there's anything else you'd like to say, Hayley?
Hello. Yeah, just to reiterate, don't worry, nothing said today is for broadcast. It's literally just for my own understanding, for my reporting going forward. And again, always, if anybody wants to help get any messages out through the media, do get in touch with me, and I'm always happy to help. And yeah, the more voices that we have, the better. And often we end up speaking to the same people in the community, which often doesn't help in getting the message out to certain groups. So yeah, my emails are always open, my phone's always on if anybody ever wants to help through us.
Thanks, Hayley. That's really good. Are there any more questions that anybody wants to ask of Dr. Loisel or Dr. Nair or Marla?
Di?
Yeah, Abbas, is it
could
you?
I ask? Yeah, yes, it is. Di, just a quick question. Just in regards to what Dr. Marla said, and it was a really interesting and valid point in regards to demographics, because if the BAME community is in the different priority groups, the challenges are yet to come, because the data will suggest that in regards to take up. So this group is in its early days, and it's a really, really good group. So I know we hear many challenges about fake news, but with any news, you have to make a judgment call, because you have to fact find yourself. That's your own responsibility in your own right. So there's that. But in regards to the challenges ahead, that's where we really understand what the take-up is like, what the scaring is there, because if people aren't taking the vaccine, we as a group will have to address that as a collective. And also, as a preventative measure, this group is actually informing and getting the key messages out a lot earlier compared to London. And if you see the rates in London and the realities there, because people are actually filling all the hospital beds, your own family members, close relatives, passing away left, right, and centre, and we're very lucky. We haven't seen that here yet. So there's a distance of reality. And if it does hit here, when the vaccine's not taken, that's another challenge we as a collective are going to have to address. So the group in itself, although we might not see the huge demand because we're not seeing it as high a rate as London, we're doing a lot of preventative work by getting this group formed. So it's early days. So I know there's a lot of misinformation out there, but it shows a real positive step in Gloucestershire that we've all come together and we're all addressing it. And rightly so, a lot of fears, a lot of misinformation, but that's why this group has been formed, to actually address that. So it's a safe environment to speak, because if we don't speak here, we won't get the messages out far and wide. So the FAQ frequently ask questions, areas of concern, maybe forming strategies of trusted voices out there, having meetings with them, with the doctors, and forming special groups with that and getting the messages out there, whether it be Polish community, South Asian community, Caribbean community. So we've got the right people, we've got the right endeavour, and it's just strategizing the next steps ahead, because we're, compared to London, we're very far off, but that can be a reality here in a short space of time. So I know I can hear all the voices, a lot of concerns out there, but we're all in this together. It's not, there's no discrimination in regards to the virus. It doesn't matter if you're Asian, South Asian, African, Caribbean, English, it doesn't matter which heritage you are, we're all vulnerable. So especially the priority groups. But I don't know, Di, how we'll be able to do this if we can get data that suggests BAME communities not taking up vaccine, and then we can do key task groups that way and target those community groups. But that's just a suggestion on my part. I hope it's useful.
That's really useful. You kind of said for me what I wanted to say. I mean, Marlo will know a bit more about, because that's exactly what the group that first met today is all about.
Thank you, Abbas. Absolutely. You're right that this is a proactive strategy instead of a reactive strategy. Totally. So all this good work is in anticipation of what might come. And you're right, we don't yet have the data to say whether our communities in Gloucestershire are taking up the vaccine or not, because we haven't got to those cohorts of patients, those groups of patients where most Black and minority ethnic people are within. Like I said, they're sort of under 65. So you're entirely right. This is proactive work. We do need to get that data, which we're going to get through the group we're working on at the clinical commissioning group level. So hopefully we'll be able to have a better understanding. But having these sorts of discussions at the moment and everybody putting their voices out there is so powerful, because we're anticipating what might come. Like you said, things change dramatically and we don't want to be on the back foot. So this is awesome, really, having these chats.
Perfect. Dennis again.
Hang on, Dennis, can I just bring in Bilkis with a question, because she's been waiting very patiently and I've missed her out. Bilkis, would you like to ask your question?
Hi, sorry. So my question was around priority groups, and you may have talked about this earlier. So I know several people who are in the age bracket 50 to 65 and who've previously had particular types of illnesses, maybe heart disease or cancers. They've been told by their GPs that they're not on the priority group, or they're not classed as vulnerable. But as you'll appreciate, many of those, many of the communities who live in BAME communities, they live in multi-generational households, so they're more exposed to risk. Maybe their children go to work, they might be grandparents, they kind of occupy a home with lots of different families living there. So I just wondered whether there's scope for them to chat to GPs about whether they should be a priority or not. And that's just something that I just wondered whether, because I was a bit concerned about those people who are really anxious about the fact that they live in homes where they've got children who are working, so that they find it difficult to self-isolate, but because they've previously had underlying conditions, they do worry about their conditions. So it's a question to the GPs, really.
Well, I suppose I can answer as to what we've been doing locally is that I suppose the vulnerable isn't just anybody who's vulnerable, it's actually trying to capture the extremely vulnerable. And so those are the people who would have had letters about shielding yeah, I think we'd like to be able to go wider than that, but at the moment that's the priority group. I understand that there are complexities in the example you gave of somebody who's living with somebody else and therefore potentially at risk if that person is working and going backwards and forwards. So maybe that is an area that needs to be considered. Perhaps that's sort of part of Marla's work as well. You know, looking at people living in communities, you know, like that, and you know what we should do about the vaccine in sort of in groups of people who are living together in those situations. But at the moment, I think we are focusing on the extremely vulnerable, those who have been shielding, you know, when the first wave came.
I was just going to jump in and just remind those people who are living in those multi-generational households that if they are having to go out to work, don't forget you have got the lateral flow tests that you can access at the Friendship Cafe. So, you know, that's there to try and alleviate some fears until the time that you're able to get your vaccines.
Thank you. That's really helpful. I mean, so a couple of the deaths that we've experienced in communities, they have been in families where they're fairly young, I would say in their 50s and early 60s, but they do live in multi-generational homes. So that seems to me to be a slight risk factor. So just concerned about that. But thank you. I think that would be really helpful too, if Dr. Marla could look at that as a particular group. I think that would be really helpful.
Thank you. And you know, things change as well. So with enough, at the moment, we have to follow what NHS England tells us to do in terms of vaccinations, and it's been pretty strict. So I totally hear what you're saying, that these are people who are more vulnerable than others because they have, like you mentioned, some medical conditions, and also there's the housing situation where lots of people are under one roof. Unfortunately, with the directions we've got from NHS England, we can't vaccinate them yet because we're doing the extremely clinically vulnerable patients before those patients. So that's out of our hands. So when you said, should they go to their GPs? Unfortunately, we don't have the control to change that at the moment. However, things do change. I know that there was a lot of campaigning within learning disability advocates about making sure that people with learning disabilities and their carers would be able to get the vaccine. And I know that that's created movement on a national level. So I think it's really important that whenever we have concerns, we feel that risk factors aren't being identified, that we speak out and have a voice about this, because if you're thinking that, there are going to be lots and lots of people across the nation who also think that. And whilst we can't change it directly, I think it's really important that we put forward our concerns, because like you said, you know, Abbas said earlier, we're all in this together. I won't say what I was going to say, but yes, we're all in this together. So yeah, I think it's important we have a strong voice if we feel things need to be changed.
Thanks, Marla. Jennifer, you've got your hand raised. Have you got a question you wanted to ask?
Hi, yeah. Can I ask, when we look at the amount of carers, nurses and things in Gloucester, there are a very large amount of BAME personnel there. What has been the take up on the vaccine for them? Because obviously they are one of the priorities, the NHS and carers. So have they been reluctant to take the vaccine, the BAM community workers?
I can answer that with a non-answer, actually. That's all right, in that we don't really have enough data about it, but you're entirely right that a lot of our healthcare professionals, we have a high proportion of healthcare professionals who are from BAME backgrounds, and we have a lot of informal and formal carers who work for the NHS. So even people who aren't registered carers, we know there's a high proportion of people who are health and social care workers who informally care for loved ones outside their already stretched work. So you're right that they are vulnerable populations, but I can say that we haven't really got data pinning that.
It would be interesting in the hospital setting to see how many of them have actually took up the vaccination, because if they all have, maybe we could use that data to persuade other BAME background people to take it up, because if they've already had the vaccination, there's no side effects, there's no trouble, it's going to give them that reassurance. We have a very large community of BAME background people in our hospitals that will have already been offered the vaccine. Maybe that's the way we can go forward in putting it out there, or doing a video to show that that is what is needed.
Di, sorry, can I just add to that point before we move on? Sorry to jump in, but while we're actually just talking about that, so I have been talking to some colleagues at the Hospitals Trust in the last week, and I know that's some information that they are working on at the moment and trying to understand the proportion of their BME staff who have taken up the vaccine. So I think that's a really good point to make, and something that I'll make sure that we follow up after this evening's meeting. And I know that they have got a staff network, which I think Omar, I don't know if he's still on the call, but he may be aware of that, and I think they've been doing some work to try and promote it to.
It would be
staff.
very helpful for us as community groups as well to put that video or put that information out there to say there isn't a problem, you know, please do get your vaccination. So for us it would even more assist us to get those groups vaccinated.
Thank you.
Sorry,
okay.
may I come in here?
Hang on a minute, Dennis. We need to do it in order, please.
Oh, sorry.
So Shirley, did you have a question that you wanted to ask? We've put something in the chat. No, if not, then I've got Amina who's got a hand raised. Amina, would you like to ask your question?
Oh, hello. Hi. Yes, one of the questions that I was asking is picking up on Bilkis's point. In terms of the multi-generational families, I think it would be common sense that if you vaccinate the grandparents, you vaccinate everyone in the house. And also looking at the issues with the children in the schools who are contracting the COVID virus and taking it home to their families. I think maybe NHS, England, or yourselves need to think about that. The other point that I was also making is that in some parts of London, they've already started to vaccinate people 50 plus. So my question is, when will you also include, let's say, that middle age range in Gloucester? Is that complicated? Sorry.
You say it was in the
50. Who wants to pick that one up? Is that...
Well, I mean, I can say that, you know, as we probably discussed a little bit earlier on, we were talking about the priority groups that we're working through, and you know, we are hoping, you know, in a month's time we were maybe a lot closer to be doing the over 50s. I'd be surprised if London are that far ahead, because I think we're pretty far ahead here in Gloucester, having done all our over 80s and care homes, and you know, pushing on to the over 70s and where we are. I think obviously some of the over 50s, they may be professionals or care workers and other things as well. So that may be why some 50-year-olds may have had it. But certainly we're hoping to move as quickly as we can through the priority groups. And I'm hearing messages that the vaccine supply route is hopefully going to be more, well, it's going to be more reliable going forward. And you know, the logistics of getting the vaccine to the various vaccine centres should improve. And so we're hoping to get to those who are over 50s as soon as we can, but I suspect it's at least a month away.
Okay. Can I just ask then, can people just turn up to this surgery and get a vaccination if they're in a priority group, or do they need to book an appointment or something?
So they will need to book an appointment, because we're having to be very careful. We know if we've got 400 vaccines arriving, that we have 400 people we can book in. So we have to be very clear that you can't just turn up. So So
right.
it is much
Yeah.
better to, you will need to book your appointment and so it can be organised and we can sort everything out properly.
Right. Thank you for that. Thank you.
That's all right.
Thanks, Shirley. Amina, would you like to ask your question? I'm not sure Amina's still on the call. Dennis, did you have another question that you wanted to ask? And then I think we're going to bring the meeting to a close as it's.
Yeah, I do, if I may. First of all, before I go into the question, it was just said, I'm not sure who said it, but she ended up saying there is no problem at all when it was being asked about how many of the BME nurses or people at the have taken up this COVID thing at the hospital. They said there is no problem. There is a problem. And what I'm trying to say, don't say there is no problem, but I'd rather suggest that you put it another way. What's the alternative? And people will accept it because, sometimes things like statement like that, as politicians often come back to haunt them. So I'd rather people just be, just give them a fact. They're not stupid. And as I said, life is what it is. We all got to take some risk somehow if we're going to survive. And technically that is, explain it that way rather than say there's no problem. I'll be a bit more tactful.
Dennis, I don't
The
think
other
I
thing, yeah,
said that there was no problem.
the thing I was really going to get at is the post-COVID effects. That is for patients who have had COVID. And are there any sort of lasting effects of COVID on them?
Can I just say that I didn't at any point say that there was no problem. Regarding the other one, I think Dr. Lazar, you best answer about the effects.
So yes, it is true that some people after COVID are having effects which are persisting. So they can include symptoms like fatigue or breathlessness. And say if they've lost their smell, that can take some time to recover and may never fully get back to where it was. So there are various symptoms along those lines that we are seeing, thankfully not in very high numbers, but I suspect going forward, and I think the CCG are looking at this, is developing a service that would support these people who may have these symptoms of post-COVID syndrome or long COVID, as it seems to be perhaps being called at this point. So I'm sure things will be developed going forward. Obviously, the hope is that if we can get more people vaccinated, we'll get less people getting COVID and we won't run into so many issues. But let's, I hope that answers the question for you.
Yes, it has. Thank you very much.
Thank you. So actually, we could get the person that's developing the long COVID service to come to one of these meetings if you would like us to do that. I'm going to bring the meeting to a close so that we can all. Yeah. So so thank you very much for everybody attending this evening and giving up your time. We want to do one of these every fortnight, and we'd like the topics discussed to be generated by yourselves as the champions. You need to bring to us what you need to hear about and what are the things that need to be better understood. It's really important, which is what you've all talked about this evening, about having trusted sources of information, and that's what we're trying to do, is trying to work with you to understand what are the things that people don't understand and how we can work better together to get the right information out to our sources. And it was suggested in the chat around role models, which I think is a very good suggestion in terms of those people who are leaders or just well trusted individuals within communities who might be able to sort of go and have their vaccination and build up that confidence. So as I say, we're planning to meet every fortnight, so the next one will be on the 8th of February. So if there's anything that you'd like to discuss at that next meeting, please let us know by email and send to the mailbox for the COVID champions. I'd like to thank Dr. Loisel and Dr. Lair for joining us this evening, which I think has been a really interesting discussion that we've had. And if there's anything else that you'd like us to discuss, or any information that you find of sources and things, please send that through to the mailbox. So we're building up a resource which is on the County Council website, particularly targeted at the BAME community, which Temi has been very much leading on. But there's also the information that Caroline is developing, the wider vaccination programme. But we're working collaboratively across the system to make sure that we bring it all together. So unless there's any other questions, I want to say thank you very much, as I say, for giving up your Monday evening, and have a good rest of the evening, and hope to see you again very soon.
Thank you.
Thank
you.
you.
Bye-bye.
Thank you.
Thank you.
Bye.
Bye-bye.
Thank you.
Find my way out of here now. There.
There we go. And then there were 5.
Well, that was really interesting.